So the question is it safe? Is it safe to take human beings in a medically supervised setting, put them on a long-term water-only fast? And so in order to answer that question, we did a study. And we took, the study ended up being, is fasting safe? A chart review of adverse events. And we published this 2018, looked at 1,100 patients that had undergone water-only fasting. The conclusions were that the majority of adverse events were mild to moderate. They were predictable, expected during fasting, that there was a correlation between aging and adverse events, but not severity, which was really the first time that was shown that older individuals, in other words, older than 65, could safely fast. And the conclusion was that the protocol that we're using at the True North Health Center was, in fact, safe. This publication of this first safety study on fasting has really opened up the use of fasting for anybody that needs to get through an IRB. The real question then is, okay, it's safe and it seems to work. How does it work? What's really going on? What are mechanisms that are occurring in this ancient practice? Well, one obviously is weight loss. Weight loss is a pound a day, and what we're shown now, as I previously showed on the slides, the majority of this weight actually is in fact fat and visceral fat. And we also notice there's a natriuretic effect in fasting, the selective elimination of sodium. This is a very powerful effect, much more powerful than what we find with, say, diuretics or hydrochlorothiazide and the like. You get a powerful diuretic effect, which drops the blood volume, which drops the blood pressure, allows non-healing wounds to heal, impacts symptoms of congestive heart failure, etc. The traditional justification of fasting was the idea of detoxification, the idea that people are toxic, that they have accumulated metabolic products inside their cells, things like PCB and dioxin and pesticides and residues. We know, in fact, that this is, in fact, true, because you can take a fat biopsy and break it down and find several hundred of these chemicals in various concentrations in people. And during fasting, these materials are rapidly mobilized and processed and eliminated, reducing total body loads during fasting, both of exogenous and endogenous toxins. Endogenous toxins being substances that, although may be detrimental, aren't traditionally toxic. They may be cholesterol or fatty materials that are normal materials but accumulated in abnormal quantity or in the wrong place, as occurs with visceral fat. Enzymes are induced during fasting both for macronutrient mobilization, things like gluconeogenesis, glycolisis, lipolysis. These are all induced during fasting, and they persist, it turns out, after fasting. So you are more efficient not only during fasting, but after fasting at mobilizing glycogen stores, fat stores, as well as gluconeogenesis in terms of protein mobilization. You also induce enzyme systems associated with detoxification, which is how those materials get out of the body, and we also believe that those detoxifying enzyme systems persist post-fasting, and they also seem to accumulate, so that every time somebody fasts, they get more and more efficient at it, just like every time somebody exercises, the glycogen mobilizing enzyme systems become better. That's part of what being a conditioned athlete is this repeated induction of these enzyme systems. Insulin, the hormone that drives sugar from the bloodstream into the cells, is profoundly impacted in fasting, and in fact that may be why about 80% of our type 2 diabetics are able to achieve normal blood sugar levels without medication. Now, granted, they have to continue to be willing to eat healthy and exercise in order to maintain the results, but nonetheless, it's a very rapid way of normalizing blood sugar levels and eliminating the need for people to use medication. The fasting mechanisms also include dealing with the gut, that tunnel that starts in your mouth and ends in your rectum. The microbiome, the 5 pounds of bacteria that live in your intestinal tract, are a very important part of your immune system. You know, 5 pounds of bacteria eating, drinking, and defecating inside you right now. What your bacteria defecate in you depends on what you feed them. And if you want them feeding you fertilizer like vitamin K rather than toxic waste like TMA, then what you need to do is feed your gut the food that they're designed to eat, which is soluble fiber, so your vegetables and sweet potatoes, not the animal foods that lead to increased production of TMA. The fasting affects the gut by affecting, we believe, this process of gut leakage. The gut has a membrane that filters out everything except very small molecules, much like this screen here would filter out the bugs. The problem is if the screen became damaged, the bugs could get through, If your intestinal mucosa membrane becomes damaged, you can leak material through gut leakage, proteins and other materials that shouldn't be there, and that in genetically vulnerable people, the immune system can react inappropriately and lead to autoimmune diseases and other problems. If you look here, the difference between one face and the other is what we call smoker's face. Smokers develop this premature aging because the free radicals from cigarettes actually cause collagen tissues to cross-link, and that's what wrinkles are. It's interesting, you know, some people claim that smoking actually in some senses protects you against things like lung cancer. And technically that's true. 80% of patients that smoke don't get lung cancer. But it's because they die of heart disease before they live long enough to grow their tumors. Because in addition to causing lung cancer, smoking causes the enamel lining of the vessels to be damaged, leading to heart attacks and strokes. So I guess theoretically, if people made smoking even more dangerous, maybe we could advertise it as cancer safe. I don't know. Fasting also normalizes the autonomic nervous system that balances the things you don't think about. Fasting also has a powerful psycho-spiritual effect. It's interesting, with all the different religions in the world, the Jews, the Jains, the Hindus, the Muslims, the Christians, even though they don't agree on many things, the one thing they do have in common is a tradition of fasting. This is an ancient practice that's recognized in most all of these traditional religions. And I think it's because it changes the way you feel and think about yourself and the world around you. Fasting enhances the immune system. It doesn't suppress the immune system. And in fact, this concept of autophagy, the idea of the body getting rid of cancer cells and getting rid of other unwanted debris, yielded a gentleman 2 years ago the Nobel Prize for his work on autophagy. And autophagy appears to be profoundly affected by fasting. Fasting also affects taste adaptation. Good foods don't taste good to people when they've been used to eating greasy, fatty, slimy, dead decaying flesh, highly processed, salty, sugary, fatty-induced foods. They become addicted to the artificial stimulation of dopamine in their brain from what we call the pleasure trap. And as a consequence, to get people to eat whole natural foods is undesirable. It takes a month on a low-sodium diet and maybe 3 months on a low-fat diet to really make that adaptation. But that adaptation can happen much more quickly with fasting, so that the end of fasting, good foods actually can begin to taste good, and therefore improving dietary compliance. We did a study on this adaptive stage. We were able to quantify minimum detection thresholds to salt, sweet foods, fatty foods, and what we were able to demonstrate was that there was a decreased liking of salty, fatty, and sweet fatty foods as a result of fasting. People actually have a change, a measurable change in their taste perceptions.